Bismillahirrahmanirrahim. Assalamu alaikum. I am Professor Dr. Javed Iqbal FAROOQI, and you are watching my YouTube channel, Health Education. Nowadays, we are discussing kidney diseases and their treatment. Today, we shall have first session of our discussion on renal transplantation. There are two options available for end-stage kidney disease: renal dialysis and renal transplant. Renal dialysis is a life-sustaining treatment for kidney failure that requires regular sessions to filter waste and excess fluids from the blood. It is widely available but time-consuming, costly in the long run, and associated with complications like infections and cardiovascular risks. Renal transplant, on the other hand, is a more definitive solution that restores near normal kidney function, improving quality of life and longevity. However, it requires a suitable donor, major surgery, and lifelong immunosuppressive therapy to prevent organ rejection. While dialysis is a temporary management option, a successful transplant offers a long-term cure. We have discussed renal dialysis in the last 3 sessions. From today, we shall start our discussion on the treatment option of renal transplant. We shall complete our discussion in 3 episodes, and today is the first one of the series. Imagine waking up every day knowing that without a kidney transplant, your life is in constant jeopardy. For those battling kidney failure, this is the reality. But there's a hope. Through renal transplantation, many patients are given a second chance at life. Live donor renal transplantation is a procedure where a healthy kidney is donated by a living person to someone in need of a transplant. Unlike waiting for a kidney from a deceased donor, that is the dead one, which can take years, a living donor can provide a more immediate and often more successful solution. This type of transplant not only saves the life of the recipient, but also offers the donor a unique opportunity to change someone's life forever. For the recipient, it's a new chance at life, a chance to get back to their family, their job, their dreams. And for the donor, the act of giving a kidney can be one of the most rewarding experiences of their life. In this series, we are going to explore how live donor kidney transplants work, who is eligible to donate, the risks involved, and the immense impact it has on both the recipient and the donor. So stay with me as we dive deep into this life-changing procedure and explore how this simple but profound act of kindness is changing the lives of kidney failure patients around the world. Every 10 minutes, someone new is added to the kidney transplant waiting list. But what if you could save a life today? Live donor renal transplantation offers a way to give someone a second chance at life, a way for a living person to donate one of their kidneys to someone in desperate need. But how does this process work? And why is it so important? Today, I shall take you behind the scenes of this life-saving procedure, shedding light on both the emotional and medical aspects of being a live kidney donor. After discussing with you the overview of renal transplant, I shall end here and to see you tomorrow in the second episodes to discuss a true case history of patient with renal transplant. Till then, take care. Khuda Hafiz.